purpose in life it should not be to turn a profit. Our purpose in life should be to love each other and to make each other healthy. And it can't all just be done through caring about each other. We actually have to do the right things. I can care about my kids an awful lot, but if I'm not willing to give up cheese so that their brain might not be on fire, my actions are speaking louder than my words.
Your health is shaped by more than symptoms. Through real stories and expert insights, we explore how your genetics, environment, and daily choices affect your well-being. We uncover root causes and share practical tools to help you find the healing you need. Welcome to the Forum Health Integrative Medicine Podcast.
Today's conversation is one that I think so many families need to hear. Autism diagnoses continue to rise, and many parents feel overwhelmed, dismissed, or told there's nothing they can do beyond symptom management. But what if there's more to the story? What if we started looking at the body as a whole system? Gut health, inflammation, nutrition, environmental exposures, immune function, mitochondria, toxins, even infections. And what if we started asking why certain symptoms are happening in the first place? Today, we're joined by pediatric functional medicine expert, Dr. Paula Kruppstadt, founder of Hope for Healing, to discuss a functional medicine approach to autism, what's happening biologically beneath the surface, and how families can better support their child's health, development, and quality of life. Buckle up. This is going to be a great one. This is going to be a two-parter, so stay tuned for next week's. Let's dive in. Welcome back to the Integrative Medicine Podcast with Forum Health. I'm your host, Amanda, and today I have a great guest on with us. We've got Dr. Paula Kruppstadt. She is the founder of Hope for Healing down in, is it Houston, Texas?
Correct.
Houston, Texas. I got this. And they're going on their 11-year anniversary, and we are going to be talking about a functional approach to autism. We've also got our co-host on, Dr. Peterson, and I cannot wait to get started. Welcome to the podcast, Dr. Kruppstadt. How are you doing today?
Good. Thanks for having me. I appreciate it.
Absolutely.
Well, thank you for joining us. This is really exciting, especially because if I'm not wrong, you're our first pediatrician that we're having. And
Woohoo!
what's more exciting to me is your IFM certification and experience, and just you bring a perspective to pediatrics that is so refreshing and so important. I think a lot of times people that are in the functional medicine world, mothers and patients alike, are a little bit uneasy around their pediatricians because it's almost like there's less openness to functional medicine. And so you're perhaps the antithesis of that. You have the expertise, the experience, and the openness. So I'm excited to have you.
Thank you. I'm glad to be here.
Me too. I would love for you to introduce yourself and give us a little bit of a background on you and how you got interested in pediatrics and functional medicine.
That's a really good question. I was the oldest of 4 kids, and I'm dating myself here. My dad went to Vietnam, and when he was there, he would send us pictures back from an orphanage. And I, at a very young age, was like, I want to do something to help. I want to do this. So in 2nd grade, I knew I wanted to help. But then it was like 8th grade, it was kind of cemented in my heart and my mind. And I really felt like that's the way that God was leading me. And so when I went to when I started high school, I knew that's what I wanted to do. And then I've always loved children. And I always felt that many times children didn't have a voice. I almost drowned when I was in 2nd grade, and I kept crying out to the grown-ups that were outside the pool, and no one was listening. And in my mind, I thought, I want to listen. So when I went to med school, I had a lot of friends that were nurses, and they said, you listen to mothers. And so mothers have a special intuition and they know something's wrong. And so when I went to med school, I loved peds, I loved psychiatry, and I loved internal medicine. Well, the internal medicine I ruled out because it was a lot of damage to bodies. And then psychiatry, 80% of pediatrics is learning to talk and to get in a good conversation with the parents and establish trust. So that's how I ended up in pediatrics.
I love
I want
that.
to make a comment here. I love how you described this traumatic experience and how it changed your life in such a meaningful and positive way. I think you'll relate to this in integrative and functional medicine. Trauma is a big part of what keeps us sick. And it sounds to me like trauma is a big part of what actually made you into the person that you are. And I think it's remarkable that something that is traumatic can motivate us for good or can cause us to be in that level of fight or flight. And somehow you didn't go into a state of fight or flight, perhaps because you were rescued, but but it
Yeah.
did change you from then on. So I love
Yeah.
that.
Yeah, when you talk about functional medicine, the center of the matrix is dealing with emotional, mental, spiritual,
Yeah.
sexual
Yep.
trauma and abuse, and people will never get well unless they address the center of the matrix, and you can know all that knowledge. So, yeah, I really appreciate you for bringing that out. My journey, I went to med school in San Antonio, Texas. I was on a military scholarship, and I paid my time back at Fort Fort Hood, Texas, and then I came to the Houston area, and I started working for a large children's hospital system here, and I was on faculty with Baylor College of Medicine for a little bit of time. But 3 of my 4 children developed autoimmunity, and I didn't know what I didn't know, and I started looking outside the box. I struggled with clinical depression for 27 years. My weight ballooned up to 300 pounds, and I probably took 11 to 13 different antidepressants, and functional medicine saved my life. I would not be here if it weren't for that, and specifically like precision medicine, doing my own precision genetics and seeing what I didn't make, what I need, and just giving my body what I needed and taking away what I didn't need. So that's kind of my journey.
It's
That's an
fantastic.
awesome journey. That's incredible. And so you've had this perspective sort of opened up to you because of your motherhood and experiencing this with your children, but then you've also had this on a personal level of saying, "Hey, something's wrong, and I'm a physician, and I have, quote, all the answers to how do I become healthy, and they're not working." That's remarkable. I don't think I have not interacted with that many physicians who've had both a personal and motherhood education. So that's
And
impressive.
there was a lot of shame around that because as a physician in the military, I had to surrender my clinical privileges. I was clinically depressed while I was pregnant. I was working 80 hours a week, and you don't have to do that in this civilian world. And so then for credentialing, I had to explain that, and I just it was just not a positive experience. And fortunately, trauma and issues that providers go through is now acknowledged, and they work with people.
Good.
But back when I did that, they didn't. So it was difficult. So,
Sure,
but
yeah, and in the
I can
military even
imagine.
more so because you're in a society, and I'm an Army brat. My dad was in the military as
yeah,
well in Vietnam, and
yeah,
I'm the second oldest, and I hear you talking, and I'm like, "Wait a minute, she's describing a shared experience here, our life
yes,
together." But,
yeah,
you there's a particular expectation in the military of your fitness, right? Both physical and
Mhm.
mental, and I think and I think this is important for patients too. There's a lot of things inside of our control, but then there's a lot of stuff that isn't in our control, at least until we know the answers. And
right.
that I think is what you were facing is, "Wait, I should have the answers, and yet it's outside of my control."
Right,
So
right, and then you wrap that in guilt and shame, which are 2 different things, and
right.
and, uh, work through it. But yeah, but
Yeah, well,
people
and
can
also the system that was set up, of course, the guilt and the shame exist because of that to some extent, but also this it can't be completely in your past because you keep having to explain why did you lose these privileges? And like every however long, you're like, "Oh, yeah,
Yeah.
let me tell
You
you
have to
again." Let me
relive
tell
it.
you again. Yeah.
yeah.
So
Yeah, it was like no harm was ever done to a patient. So, I definitely have a heart for people who struggle with depression and those kind of things too. So,
Absolutely. Well, want to start. This is a really good segue into right now you have your own practice, Hope for Healing. We were kind of talking about this a little bit earlier that you're going on year 11, and I would love to learn just a little bit more about your practice. Are you primary care, and what does that look like for your patients when they come to see you at Hope for Healing?
yeah, we are primary care with everything with a functional lens. We don't take insurance. We accept health savings account, flexible spending, that kind of a thing. But we encourage every single person who rolls through our door to do their own. It's called Wellness Blueprint. It's our a company allowed me to make my own proprietary panel, and it's kind of my answer to so many people who come to us who have a child who's autistic or a child that is not where they should be on neurodevelopmentally, but it's very applicable to older adults because we know that neurodegeneration mirrors neurodevelopmental abnormalities. They're incredibly similar. So Um, we have people come in and we choose kind of their care path if they're not having problems. Like today, I got to see a newborn. It was so nice to see a newborn, a 6-day old. I don't get to do that too often, but it's like riding a bike. It comes back, and told the mom and the dad. I said, "Can I just hold him just for a few seconds? We've got a little bit."
that's sweet.
And I'm a grandma too. I get my share of little grandkid fixes, but we address right out the chute, these are the foundational principles of functional medicine, those things that we all as functional medicine practitioners, we want environmentally, we want them to have clean care products, water, get good hydration, good nutrition, um, good sleep, movement, no toxic environment, no toxic people. And we have health coaches that are involved and walk with people through that journey. And then we have the folks that are desperate and they've seen everyone. I think it's like every functional practitioner out there. But we dive deep. We treat vector borne illness. We treat chronic inflammatory response syndrome. Vector borne is like Lyme, Borrelia, Babesia, tick-borne relapsing
Mhm.
fever. A big PANS PANDAS focus. And if people are listening that don't know what that is, it's pediatric acute onset neuropsychiatric syndrome. It's just, these drastic changes where children become OCD or severe restricted eating, and then with several other things to meet those criteria. And strep is a subset of that. It's like an
Mhm.
autoimmune attack on the brain. But basically, everything that can give you a fever can cause PANS or PANDAS. So we meet with the patients, we look at their timeline, and we walk through them, and so it's primary care. And then some people just want to come to us for functional medicine care,
Mhm.
and all ages and stages are welcomed through the door. Not everyone's a good fit. And
Yeah,
so that's where we try to determine if we're a good fit for those folks. So that's kind of a picture of our practice.
I love
That
that.
sounds like an amazing practice.
Thanks.
I
Yeah.
envy a little bit the being able to see 6-day-olds, although I would be far more nervous than it sounds like you were like, "Oh, no." So, but yeah,
And
that's honestly, that's how healthcare should be, right? We should be able to take care of people and these whether it's more longevity, like you said, people that just wanna optimize their health, or these chronically ill people that get marginalized and no one has answers for them because it's complex, and you're looking at every aspect of that. So it sounds to me like if you live in the Houston area and you have a complex chronic illness, you now know where to go.
It's your
yeah,
lady.
yeah.
Yeah.
I am so curious. So you just had a 6-day old baby in your practice who is just establishing care. What is I'm almost looking for like a side by side comparison. What is the journey of a 6-year-old look like with you versus what they would get if they were going and establishing care somewhere else, like in the traditional system?
At Forum Health, we uncover the why behind your symptoms. With advanced lab testing, hormone optimization, and cutting edge therapies, we help you heal and perform your best. And now, through shopforumhealth.com, you can access physician grade supplements trusted by our providers, supporting everything from adrenal health to focus and longevity. Learn more at forumhealth.com and explore supplements at shopforumhealth.com.
Well, standard pediatrics is vaccine driven. That's
Mhm.
just the truth of it. And individuality is not taken in, it's still the cookie cutter approach. It's still, and, you said it very kindly, Andrew, that, it's unfortunate that pediatricians tend to be the most closed minded because we have been indoctrinated. I mean, I went to Liberia, West Africa on a mission trip when I was in medical school, and I saw children and adults die from vaccine preventable illnesses. But when you come back to the United States, and I thought it was my job to be the Holy Spirit and convict people to take vaccines until I learned what I didn't know. And we are not a third world country. We have clean water. And just about the time the public health crisis in the US was addressed was about the time that the vaccines came on the scene. And I'm not downplaying anything. I'm not downplaying the power of vaccines. Okay. One of my patients in Liberia, I walked in the next morning and said, "Where'd so and so go?" They said, "She died last night." And I said, "You're kidding me." I was supposed to debride a foreign body between her toes that was carrying tetanus, and I didn't because I didn't see that it was real infected if I had done what the attending at this mission hospital had told me to do. But we didn't have tetanus, we didn't have IVIG, we didn't have, well, they probably had TIG, tetanus immune globulin, but I think she was too far gone. Anyway, but it's like you never forget those life lessons. And so, we don't wrap umbilical cords with dung. So back to your original question, Amanda. So
Yeah.
typically, when a baby is born, they're seen within 2 to 3 days of life. And then at 2 weeks, and then 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and then every year thereafter.
Okay.
So, and they receive vaccines when they're born. Hepatitis B, 250 micrograms, which is 10 times the amount of aluminum that's within the Hep B that is recommended to be given to a child. Don't get me started. I'm on my pedestal, on my podium here talking about it.
Yes.
But
But Dr. Kruppstadt, that's why we wanna talk to you because you have
Yeah.
such a balanced take on
yeah,
this, and people need that.
yes,
So we're gonna get you
yeah.
started, and we're gonna keep you going.
Okay. Okay. Well, the American Academy of Pediatrics, I think it was JAMA, published that the amount of aluminum should not be more than 5 micrograms per kilogram. So a newborn baby, a 5 kilo baby is a big fat baby. That's more than 10 pounds. So if you're giving 250 micrograms in a hepatitis B to a non-drug user, a non-HIV positive mama, why the heck are we doing that? Why don't we wait until our children weigh more and if
Mhm.
they choose to make decisions that don't necessarily align with our decisions, like we don't want them to be sexually active, wait until they're older, let them choose if they want to Hep B. Okay.
Right, but they're certainly not gonna be sexually active on day 1. So
No.
the
No.
timing
So
seems a little weird.
yeah, so why are we injecting them? So it's like, what's the motivation behind that? Why aren't we thinking about the science? And then JAMA directly contradicts that. And that was done on hyperalimentation for, what they were giving to babies in a NICU via IVs. And they saw that if they gave more than 5 micrograms per kilo of aluminum, which is the stimulant or adjuvant in the majority of the vaccines now that that caused the loss of IQ points and things. So anyway,
Let
why
me
are
let me
yeah,
just a second, and we're gonna.
sure.
So if you'll let me, I think that patients are people in general, not just patients. People in general are very binary in our thinking, right? And we're like, well, aluminum, it should have no aluminum. Aluminum's bad. I don't want any. And so I think, owe the people an explanation of why is it there. And
Yeah.
what's happening is without an adjuvant, the vaccine would be effective for somewhere between 2 and 6 months.
Mhm.
What happens, this is important for people to realize, is when you show the immune system something, it will respond, but it won't keep responding for years and years without that adjuvant. When they first developed a smallpox sera, before it was really a vaccine, they could give it to you and they couldn't make a whole bunch of it because you had to get quite a bit of it. One horse would provide enough sera for about 4 patients. Well, that's not very effective. But they found that if they put an adjuvant, something that would continue to irritate, that's a fair word, the immune system would persist in its immune response. And so the tiniest amount possible of this adjuvant, aluminum is one of the ones that's used, as long as it's low enough, then it won't cause these neurologic problems, but it has to be high enough to cause a continued immune response. And that balance is what we're trying to find. It's not black and white. It's not, is this bad or is this good? Right. And so for some patients out there that maybe become a little bit too connected to everything needs to be entirely natural, that explanation will help. And then for the
Yes.
conventional people that say, well, but it can't be bad. Well, no, it can be bad if it's too much. And
Uh,
that's where we really have to stop. And I think you spoke to this, which I appreciate. Stop thinking of ourselves as public health advocates and start thinking of ourselves as physicians for individuals. Because
exactly.
the need for a vaccine changes dramatically depending on your individual situation, right? And the timing
Yes.
changes.
Yes.
So understand for the patient, maybe that's why I interrupted, is just so that they'll know, why do we put any aluminum? Well, because it wouldn't
Right.
work for more than a few months if you had none, right?
Right.
And we don't want to die of tetanus.
Yeah.
Can't
I
happen.
I really appreciate that explanation. I mean, because there is a time and a place for all of that. For soldiers, squalene is the adjuvant, and then all these soldiers came back from the Gulf War with Gulf War syndrome. And we
Mhm.
have learned in turn that those individuals have this condition called chronic inflammatory response syndrome, which is environmental stuff. But, at least we took a lot of the mercury out, of the vaccines. But it's like you said, you need something. I had a mom call me with someone who had been with me from day one, and this little guy was on all of his systemic support of his body. He was on anti-inflammatories. He was on what we call autophagy support, meaning the ability to pull glucose in from the cells. He was on appropriate mitochondrial and methylation and B12 support. So when his mom called me and said at age 4, he sliced his arm at a marina, should we take him and get a tetanus shot? And I said, I want you to take him and get a tetanus shot. And he's been on all these things. I think you're good. You know, uh, it's all in the timing, and I really appreciate that too. It's like people go, "Well, why are you using a pharmaceutical?" And I'm like, "Well, low dose naltrexone has a very low side effect profile, and it's so powerful, so it's all in balance." So getting back to that original question, vaccines are typically given at hepatitis B is typically given at birth or 2 weeks, and then at 2 months of age, 4 months of age, and 6 months of age, diphtheria, tetanus, pertussis, Streptococcus pneumoniae, polio, and then sometime between 12, 15, 18 months, measles, mumps, rubella, and varicella, and that is where we run into the majority of challenges with children that have, as I call, hitches in the giddy up with their immune system. If you
I
can
love the Texan.
Yeah,
Yes.
if you can identify those vulnerabilities and move that out until they're 3 to 5 years old, and you're giving their body the support it needs, then you can typically prevent. Now I'm going out there. I'll just say make the chances of developing a neurodevelopmental challenge a lot less. The thing with boys and girls is that, and I am going to be a little stereotypical here. You can have a little 1-year-old girl holding her baby doll, pretending she's on the phone, stirring a pot, say, pretending, and she's doing all these things at once. Then you have a 1-year-old little boy who's lining up his cars and going, uh, there's there's and not all little boys are like that, but there's a system called the vestibulocochlear system that matures at a later time, around 3 years of age, around 36 months of age, where little boys are mature, whereas girls are a lot sooner typically. And it's how they receive information in through their ears, their eyes, where they are in space, how they hear and perceive things. And that's why 4 out of 5 children diagnosed with autism are boys and not girls, because they're hit with an aggressive inflammatory trigger at that 12, 15, 18-month vulnerability. And I hear that all the time here, and
I
it
love it
grieves
when
me.
doctors on this podcast explain that sort of science, and I love it when we acknowledge the biological, realities. So, thank you for that because the truth will set us free, right? We
Yeah,
we don't need to pretend that there's not differences. There are differences in all sorts of diseases, and pretending that they don't exist is doing one of the 2 genders a disservice, right?
that's right. We're made differently. We're made differently. Multiple browsers versus single browsers, and that's reality.
My
Yeah.
wife probably has 200 windows open on her computer right now.
Yeah.
I have 6. I can't
I
think of more
have
than one thing at a
a
time.
million. Yeah. I think
That's
one
right.
thing that is so just for our audience, we're talking about triggers being a cause of potentially developing neurodegenerative autism in young children. And I think that's important just to highlight and just say is that autism isn't something you just look at from a behavioral perspective. It's something you look at from a biological, like what's under the hood perspective.
Right.
And so when a child comes into your office with autism, what are some of the first things that you're evaluating?
I love that we're starting with vaccines, and I actually wanna come back to that if you'll give us that much time. But
Sure.
if you could identify the triggers that you think are involved in the neuroinflammation, the immune response that's
Hmm.
responsible for autism, and it might be a list of 10 things, it might be 3 things. What are the
Hmm.
things that you say, "Hey, these are the things I have to pay attention to from mold to vaccines to what have you?"
Hmm. Environmental medicine is a huge piece of that. 25% of the population is vulnerable to develop a systemic inflammatory response. And just because you have the vulnerability doesn't mean that's going to happen. The other environmental factor is we look at our world at this point in time and we are being assaulted day in and day out by glyphosate, EMF, electromagnetic fields,
Mhm. Yep,
5G towers,
yep.
and toxic body care products, and then what we put in our mouth. I mean, things you can't, teaching a kid to read a label is one of the most valuable skills you can teach a kid to do, that can read. And my grandson, he says, "Is this poison, grandma?" And I'm like, "Yeah, it's poison." And so, but it's environmental because the genetics haven't changed. The genetics haven't changed. I mean, my generation, we've gone from, Tupperware, herbicide, pesticides, disposable diapers, and now we have microplastics, forever chemicals, PFAS, parabens, phthalates, all that stuff. So it's the assault environmentally, but there are some there are some spontaneous genetic things that you'll see, but we always take Fragile X off the table and something called the chromosomal microarray. And I get kids all the time that have been diagnosed by a clinical psychologist. They haven't seen a PD neuro. They haven't had an MRI of their brain. Let's make sure all the structures are there. And also let's look at volumetrics of their brain. And so I think the biggest thing that we need to look at is genetics, yeah, it loads the gun, but the environment pulls the trigger. So I would just say our freaking toxic world, it is just so bad. We're just in this toxic soup.
Are there
I
toxins
have
that
a
you always check? Like, do you always, or does it depend on their presentation? Does that
It depends on the presentation. One of the things we ask people are, mom and dad, what do you do for a living? Where did your parents grow up? Where did you grow up? And where do you live? Are you within a mile of a golf course? Are you within a mile of a school where they're spraying all the time? And I have to
Mhm.
tell you, the highest levels of mercury that I've ever seen as a functional medicine practitioner, we did like a provoked urine test, was in a child of 2 chemical engineers, and
wow?
his mercury was the highest I'd ever seen, and, that was terrible. I mean, it
They
was
probably work for
terrible.
like the petroleum companies.
Yes, yes.
Yeah.
And
Wow.
down here, we have people that live in different places, and it just depends, like, so let's say, the parent handles firearms all the time. Well, I'm like, "Disrobe in the garage and, put your clothes in a thing, go in the house and shower before you touch your kids."
Yeah.
It's and you just don't know. So,
I'm curious what your thoughts are on I don't have any kids yet, but we're having those conversations. And there's, it's so interesting. Some of my friends are putting their baby shower registries together. And I am seeing so many registries where here's a mat that your baby can lay, but it's obviously there's EMFs and like here's a Bluetooth mat. So if your baby farts, you'll know. Like the baby's gonna fart sitting there, whether I like it or not. Do I need to know if it farted? I don't think so. But like there's EMF everywhere. Here's a little rattle for your baby. By the way, it connects to Bluetooth so you can turn it on. It's a rattle. Does it need
yeah,
so what are your thoughts on all of like the EMF and like the Bluetooth stuff that are coming
that
out for
is
children these days?
that's awful stuff. It really is.
Okay.
It's terrible. It's like cover the router with copper cloth or something, and if you're gonna get really crunchy, you'll turn your Wi-Fi off at night. We
Me too.
haven't quite gone that far, but I mean, it's real. I mean, we had a little girl that came to the practice who had leukemia, and the wall behind her bed, they opened up that wall and it had all these electronics in it, and that's where this kid laid every night. So, I I don't know, but it's like, Stephanie Seneff, who's the MIT professor, and then looking at, this nice little soft calvarium, a skull, and you put a cell phone next to it. It's like, use your protection,
Safe
versus an
sleeve. I know
adult.
that.
Yes, yeah, it's like it's very real, and I'm so glad now they have, like, glass bottles and things like
Yeah.
that, it's so much better, but all the EMF, it's really bad. Your initial question, the thing that we do differently is we start babies on vitamin D3 plus K2 from day 1.
Mm.
Mhm.
For immune
One that
support? Is
Yes,
that what? Okay.
1,000 IU every other day until they're 4 months of age, and then we give them a drop every day, and in all these years, I did, like, a little retrospective look-see, had about 150 some kids. Only maybe 10 to 15 was a little bit more than 100 instead of, in the toilet.
So when they're
20s, 18.
that age, when they're a week old or 2 weeks old, how are you giving them the vitamin K? Is it a drop?
Drop straight in the mouth.
Okay, makes sense.
Orthomolecular liquid D3 plus K2
Perfect.
straight into the mouth, and
5.
1,000 IU every other day, and, then when they hit 4 months, we do 1 drop every day.
Is there a
Yeah.
time at which you would say, "Okay, he's 4 months or he's 4 years old now or 6 years old now. now my son doesn't need vitamin D because he's making it well enough and he's past this risk of developing autism? Or do you think, no, just stay on it?
No, we check that and we keep everybody on D3 with K2. But, if genetically you don't have the receptors for it, BDR TAC, doesn't matter how tan you are, you could still have a terrible vitamin D. So we check those levels. We check those at a year, just like we make sure that a baby's not iron deficient.
So you just
Because,
keep them on that because it's always useful.
yeah,
Okay.
absolutely. Absolutely. And we aim for 80 to 100.
Right.
Always,
Yeah.
always, always. Yeah.
Well, that makes perfect sense to me. I certainly agree with that.
I want to ask, how connected are the gut and the brain in children with autism?
Intimately connected.
Come back next week for part 2. Just kidding.
Thank you for joining us on the Forum Health Integrative Medicine podcast. Each episode, we help you understand your health from every angle and inspire your lifelong wellness journey. Follow the show, share it with someone who needs hope, leave a review, and take the next step toward feeling your best at forumhealth.com.